If you're watching us on RADTV at members.radradio.com, you already know that Dr. Patel from Granite Bay Allergy at granitebayallergy.com has joined us in the studio, one of our favorite guests.
Yes.
And we got this email from Sandy.
Hi, Sandy.
Says, Dr. Patel, thank you so much for noticing and or caring enough to let me know the important information that my regular doctors didn't. I paid out of pocket to see you months ago when I heard on the RAD show that my eczema could possibly be cured. Which one's eczema? Is that the skin thing?
Yeah, one of them, like allergic skin.
Those weird, not to any. I have a really close friend that has eczema, if I'm thinking the right thing, but you get like blotches and stuff.
That's hives.
That's hives. Okay. Yeah. So what is
eczema is like a rough little very itchy rash, usually from like allergies.
Okay.
Oh gosh.
So she says no one has ever told me that it could be cured. They just gave me creams that did nothing. I showed you my biopsy report that I received from my dermatologist, who simply said that the report shows I have eczema. You said it's consistent with eczema, but there is something else going on with me. My doctor didn't tell me that part. You said I need to make sure my doctor finds out what else is going on with me. I followed your advice and insisted they find out what was wrong with me. I have now been diagnosed with celiac disease. It took 50 years to find out why I have eczema and maybe even migraines. Now I can work on repairing my body instead of having more damage done.
Yes.
And I also learned that I have to advocate for myself. Thank you, and thank you to the RAD show for letting me know about you. So much in there. But let's go in reverse order. That advocate for yourself thing is a big deal, isn't it? Patients need to speak up.
Yeah, it definitely. It's like a lot of times people assume, which mostly is right. It's that everyone thinks about everything, but people are people, and in humans, it's sometimes you get stressed out, or you have too much work, or you have and the way the medicine works right now is like, every year medicine gets cut, especially, primary care. You can walk in and say, my eyebrow itches, my knee feels funny, and I sometimes pee too much, right? It's like you can talk about anything. And it's hard to focus in unless you kind of say, hey, I'm really concerned about this.
When it's intimidating too, because a lot of people, they don't know how to talk back to their doctor. And you kind of deal with this because you deal with a lot of patients like Sandy who have been told one thing by their doctor, and they come to you and you're like, no, they're either lazy or they're too burdened. They're not looking deep enough, kind of thing. And then they have to go back and say, wait a minute, I went to this expert, Dr. Patel, and he's saying do more tests. And does that all line up to you? Does that make sense that eczema could go to celiac disease, could go to migraines, could all be connected?
Well, in this case, I don't know the details. I can't remember the details, but I do know that sometimes things look like eczema is like a generic statement for like an itchy rash, right? And then there's different types. Celiac disease. There's like a version that looks like eczema. It's called herpetiformis eczematous.
Wow.
Forgot the name. But anyway, it's like a herpetiformis eczematous herpetiformis or herpetiformis. Basically, it's like a rash that looks like eczema, but it's not. There's like little nuances that are a little different, and then you have to kind of say, hey, well, this is not normal eczema. Like, if you have it and it doesn't flare up with allergies, then like, well, eczema usually does. And if it's not allergic and it still looks like eczema, then you're like, well, it's probably not atopic dermatitis, which is what most people say eczema is. So
I just would like that email is such a big deal, because what you say after 50 years finally, because celiac's, what I know of it anyway, two of my friends actually have it legitimately and have been tested for it and all that. Like, you prior to that aren't even being able to absorb the right amount of nutrients, that your body needs or whatever. And I don't know if there's different forms of it, but I know that's what happened with them. And so it's like, this is literally like almost just quality of life saving for this person. Like, that's a big deal.
Well, true, yeah. True celiac is like that, right? Like, if you have actual celiac, then if you eat gluten, then you increase your chance of these kinds of rashes plus certain cancers.
Yeah, yes, like life-saving.
So is celiac related to eating a lot of wheat? Is that what disrupts it a lot, or is it all gluten?
No, it's all gluten, and it's a very specific one. It's biopsy proven. You have to get a biopsy, and then they see what's called blunting of the villi, things like that. But it's an immune reaction, but not an allergic IgE immune reaction. It's more of an IgG and other types.
One of my girlfriends has it bad, and she's so bummed when she found out that that's what was happening, because there are times where she's like, I just want this burger that's basically full of gluten, and so it's once in a blue moon she'll do it, but it's like one of the best she's ever had, and so she's like, it has to be worth it because you will pay the price. for her anyway, for a couple days. Her body is just messed up and the migraines. So she's like, you learn what's the quote worth it to pay the price, but like living your life like that, not knowing that's what was causing it and no one diagnosing you.
Well, and the other thing we talk about every time you hear Dr. Patel is you have to deal with a lot of people who self-diagnose, who immediately think this is what I'm allergic to, and so you've got people who think they have celiac when really it's just, well, I'm not. There's foods that I'm eating, things like that. So we got this email from Lorraine, who says I developed a sun allergy when I hit my 30s.
Oh.
I've never had a problem before, but now when I go out, my skin burns, and if I forget to put sunblock on, I break out in hives.
Oh no!
How can I fix this?
Oh my gosh!
First of all, is she allergic to the sun?
Well, there is something called solar urticaria, and it does happen.
And does it happen out of nowhere in your 30s?
It happens kind of urticaria, the hives you're talking about, the blotchy, that can happen anytime. It's one of the theories is like some kind of molecular mimicry, maybe a virus kind of triggered everything. Once you clear the virus, your immune system kind of gets confused and hits some of your own cells.
Can it be treated?
Yeah, definitely. There's regular stuff is antihistamines, but after that, there's an injectable medicine called Xolair or omalizumab, and that usually once a month takes care of pretty much everything.
We're talking to Dr. Patel from Granite Bay Allergy. Phone number is 888-989-9811. You can email us, RAD@radradio.com. Hello, Haley.
Hey, so I have a question for Dr. Patel regarding my daughter's allergies. She's 7, and it started... I'm going to try and make this short, so just bear with me. But it started December of last year at her Christmas party at the end of school, right before Christmas break. She came home the last day of school, and she was inflamed head to toe in just a rash. I rushed her to urgent care. They gave her Benadryl and a steroid. It cleared up. And then in March, it happened again. So we got her an appointment for an allergist. They ran a bunch of tests. The test came back positive for cats, dogs, pistachios, and fish. Not shellfish, though, just fish. But none of those are consistent with the 2 flare-ups that she had. So the allergist was totally confused. So was I. We're still trying to figure out what it is that made her flare up, but they ran blood tests, and nothing came back on the blood test, but her platelet count was really high. So I guess is there anything that my doctor could look into or the allergist could look into that neither of us are thinking of?
You have that look like you've heard this a million times.
Yeah. So... a lot of times you try to find an external cause, but we need a lot more details. But first of all, it's not necessarily allergy related, like a typical allergy of what you're thinking about. When you have 2 flares in December and March, several months apart, we kind of call this is hives again. It sounds like hives if this is what it actually looks like. So if there's like a cutoff, if they're more than or less than 6 weeks. If it's under 6 weeks, it's a viral thing, mostly 50% are viral, other 50% unknown. If it's more than 6 weeks, it becomes a chronic form, and then we look for other causes like autoimmune or vasculitis or sometimes, other things, basically. If all that comes back negative, then it could be just a chronic form, something called chronic spontaneous urticaria or autoimmune, some version like that. So it wouldn't necessarily be from that. Elevated platelets doesn't mean anything. It just means inflammation, like ESR, CRP, platelets, all those go up with anytime you're inflamed.
Is there, back to the self-advocating, what can she do? That she goes back to her doctor, her allergist, or does she just have to come see you, or what's the next step here?
It depends on what the blood test they did, but if they screened out all the really bad stuff and it's all normal, then the diagnosis becomes, chronic spontaneous urticaria, and then you just suppress it. And, the textbooks will say it cycles 3-4 years and then goes away and maybe comes back later on, but for kids, it can just go away forever.
What is the deal with Benadryl, by the way? Why is that like the go-to thing that everybody, like not even doctors, like all of us are like, I'm having a reaction. Somebody wrote in last time you were here, I remember it still, and we didn't get a chance to read it, but it was like to Dawn's friend's story. They know that they're quote-unquote allergic to something, but it's so good, they're going to eat it. So they take a Benadryl, they eat it, and then they don't have a reaction. Is that all like mumbo jumbo, or is that legit?
Well, if it was actual true food allergy, Benadryl won't do anything, right? You'll still swell and your throat will feel close up, you'll just be sleepy or less itchy from it. Right? But it's like, the treatment I always tell, whenever I talk to like ER docs or other people, is like if someone comes in and they have two systems, like, obvious ones are, oh, I can't breathe and you're covered in hives. Yeah, you give epi. But then subtle ones like, oh, my lip's a little swollen and my chest feels a little tight, or, oh, my lip's swollen, my stomach feels weird. That's still two systems, right? So you're still supposed to treat that with epinephrine. People will go to Benadryl, and all that does is slows it down a bit, maybe makes you less itchy or sleepy, but your throat's still going to close up and you'll still have all the anaphylaxis symptoms.
Hello, Carly. Go ahead.
Hi, I have a question for Dr. Patel. So my son is going to see an allergist next week, but I want to just be as prepared as possible. So when he was really young, he got an ear infection and we treated it with penicillin, but he got another ear infection and so they gave him Augmentin. And when he had Augmentin, he threw up with each dose, but then on day 3 he got some hives. And the hives were only on his extremities and not a whole lot, and it kind of never on his torso. And so obviously my pediatrician was like, let's find out if he's allergic to penicillin. And here we are going to the allergist. But I just want to know, is there like any questions? Like, is there any different procedures I should be asking about? I just find it odd that it was like on day 3 that, the hives came. I just I don't want to, put my son, because he's only 16 months old, through a whole lot if I don't have to.
Jeez.
Yeah. Oh my gosh.
Yeah. So the big question here is, day 3 is not normal. It usually would happen after the first dose. However, it depends on how long the hives last. If the hives lasted less than 24 hours, then you can say, all right, maybe it is the medicine. Also, if the hives occurred within 2 hours of that dose, right, then again, it's more likely. The other thing that happens a lot is when you treat a viral ear infection or viral infection with an antibiotic, you can get this idiosyncratic reaction where you break out in hives, and then those hives last several days. And then people incorrectly blame the antibiotic for the reaction. And basically, any antibiotic would have done the same thing. So really, and if you look at the numbers, 85 to 95% of upper respiratory, like a sinusitis or a pharyngitis or bronchitis is actually viral, and you don't really treat that with antibiotics. And for ear infections, it's about 70%. So, if you look at the numbers, odds are it was probably a viral infection, maybe. I don't know. But then maybe you got an antibiotic and maybe then the hives broke out. But, day 3 for that to happen is not consistent. But
So, A, I don't think the word hives has been used on this show this many times in one day ever. And B, a lot of times people misunderstand the qualifications of people they're seeing. What's an allergist? And what are you an allergist? Or what because people, that's the second time an allergist has been mentioned.
Yeah, so allergy, asthma, and immunology. So the way I like to think of this, most allergists will do allergy. Some do immunology, and the difference is, if you immunology is much more time consuming, and you have to keep up on that a lot. And it's an interest. If you have an interest in it, you'll do it, right? And some even they'll say it. We practice primarily asthma and allergy, and not necessarily immunology. So the difference is, what you like and what you do, and usually everyone's pretty clear on what they would treat. If you look at someone's website and it says all allergy or asthma stuff, then probably not much in the immunology side.
So, I'm sorry, Brandon, I didn't see your hand up there.
So is it possible that somebody can have an allergy to tattoo ink? Or, and specifically, is it possible for an allergic reaction to occur years after somebody were to get a tattoo? The reason I'm asking is because I have 2 tattoos on my arms, fairly large, and they started to grow, bumps started to appear on the actual ink itself. And only in that isolated area. There's circular shapes and everything, so there wasn't it wasn't bleeding into the regular, the untouched or uninked skin. It was just the inked part. And at first I thought it was a sunburn, because sometimes that can happen, and the skin will bubble up a little bit, and it has been super itchy now for weeks. It really hasn't gone away. I have to apply lotion in order to get some relief, but I've been putting off getting an appointment just to get this checked out, because I've just been brushing it off as like a sunburn of some sort. But is it possible that I'm having like an allergic reaction to the ink at all?
Yeah, there have been cases just like this where you have a tattoo and then you develop an allergic contact dermatitis to that. So somehow you got sensitized to something similar. And then now your immune system's attacking everything that has ink in it. A lot of times, the prototypical case is people who get a hair dye, right? And then one time they get a hair dye all of a sudden and they have a horrible contact dermatitis. Like, what happened? Well, it turns out that there's a chemical in those black henna, when you go on vacation and then dark. So they add a substance to that to make it black because henna's brown. And then you get sensitized to it. So then when you use hair dye in your hair, your body thinks it's very similar. So then they basically attack it.
So if that's what's happening to Brando, what does he do?
Unfortunately, their contact dermatitis, you can't do immunotherapy or shots to. So it's like poison oak, where if it is that, the only treatment is avoidance, which is usually for tattoos, it's like laser.
Oh, you get it. You have to take it off.
Yeah, you can't have the ink.
Dang it.
Whoa.
But if it is this,
Is there
Right,
okay?
yeah.
Is there any type of like way to offset the effects? Back to the Benadryl thing. Is there anything that when he has an outbreak, he can take?
Yeah, well, topical steroids. So more high potency topical steroids.
So as long as we're using you for free medical advice, the whole show and the audience has been witness to my 48 hours. We've talked before. I have what's called seasonal allergies, but they're not seasonal. They're all the time. So I'm on Zyrtec at your recommendation. I switched over the Nasacort or one of those things, right? The daily nasal spray. But I'm used to regular allergies, the eyes and all that, whatever. So on Tuesday, after everything was fine Monday, I woke up on Tuesday, and I had a little more mucus or phlegm than usual, but that's not abnormal. And a little bit of that, when you're getting sick and you swallow, you have that lump where you go, oh God, I'm getting a cold. But that went away. I had a headache when I woke up. That went away in an hour. And but man, trying to clear my throat was impossible. And so as Tuesday's show went on, my voice got more and more like I'm regressing into teenage puberty. Can't clear my throat. No pain at all whatsoever. And then literally yesterday, I could barely talk. Like I'm doing salt water. I'm doing, throat coat. I'm doing lemon and honey and anything you can imagine, Mucinex, all the stuff. And I could barely talk yesterday. And now you hear me today, and I'm almost, what is this, 80%, 70%?
I mean, it's night and day from yesterday.
And
So much better.
is this allergy? What is this?
Well, were you clearing your throat a lot
I mean,
or coughing, anything?
you mean prior?
Like yesterday, I guess, or the day before.
Yes.
Yeah, so you most likely irritated your vocal cords, right? So you have a lot of postnasal drip, hits your cords a bit, and then you clear your throat, you clear a lot, and you irritate the vocal cords, just like laryngitis, right? And then...
Which is what I thought maybe I had.
Yeah, so it's more just due to coughing or clearing your throat a lot. So for those, we always say, like what you kind of have, like the water bottles or something, and every time you feel you need to clear your throat, take a sip of water. Take something that pushes it down instead of bringing it up.
Which is very difficult to do when you talk for a living.
Yeah.
But so but that's just like literally, that's not abnormal or it just happens?
It could have been, it could have been allergy. It could have been an infection, right? Like maybe a lot of times, let's say you had an infection of like a rhinovirus a few years ago and you got a similar version of that now, and then when that happens, your body has immune memory. You'll mount a quick immune response. You'll have some sore throat, and then you'll destroy it and you kill it before it even can set up shop, and then you get over it. A lot of times that's why we don't get the same thing over and over again unless you have an immune deficiency. So when this happens, you feel sick for like an hour, or even in your sleep, and you wake up fine. So, for allergy just to happen for an hour or two, then go away and not come back is less likely. But if it's like a sore throat that you felt like you were sick and you weren't sure if you were sick, you probably were. Just not that much.
Alex wrote in and said, I use Benadryl as a sleep aid every night.
Oh.
Are there any long-term problems or negative aspects to doing that?
No, Benadryl is probably one of the safest. However, there was like a case series written about like older people using Benadryl in a small association with increased dementia. Now,
But you're not alarmed at somebody who's taking Benadryl every single night to sleep?
if you're young, not really.
I don't know, I mean, obviously I'm not a medical professional, so it's not
No.
based in that, but it's like, when I hear that, I'm like, don't you want to learn to fall asleep on your own? Right? Like, you to have a whole lifetime where you have to have something that puts you to sleep. It would bother me if I needed something that always made me fall asleep. I'd want to try and learn to fall asleep.
Sometimes that's too much work. Right? Sarah wrote in and says, I have a reaction to gluten where I'm almost immediately drunk. Not the fun drunk, the slurring, falling over, hurry up and put me to bed drunk. Have you ever heard of this?
So there's this rare syndrome. I can't think of it now, but it's basically like it's like brewers. I can't remember the name, but basically it's like certain carbs go in your gut and certain enzymes can't break it down, and then basically the bacteria, the microbes in your gut make alcohol from it. So I don't know if it's like brew makers.
Can it be treated?
The GI folks usually treat this,
Yeesh.
but I'm not sure how.
I'm thinking of brewer's yeast, but I know that's not what
No,
you're
it's
saying.
called. There's a name. I gotta think of it. It's,
But you need probiotics.
Yeah. Glenn wrote in and said, I suffer from chronic congestion, and I just found a nasal spray that does not contain saline. Does Dr. Patel have an opinion on this? I can't do nasal sprays that have saline as it gives me a bloody nose.
Oh, ow.
well, the lavages, the Neil Med sinus lavages are usually the best.
What's it? Lavages?
The washes, the squeezy bottle
yeah.
goes in, it comes out. Now, I'm not sure what nasal spray he's talking about that doesn't have
Yeah,
saline.
he didn't mention it in his email.
Yeah, so if it's Afrin, that's bad. If you don't use Afrin more than a few days in a row.
What if asking for a friend? What if
Yeah.
you use two friends? You use Afrin every day, maybe twice a day for I don't know
3 times a day.
20 years or so.
Yeah. So what happens is, you've heard of the Afrin addiction,
Yeah.
where basically if you don't use it, you get a rebound swelling, and
terrible.
you can always tell when you look in the nose. It's called rhinitis medicamentosa, where basically the turbinates swell so much you can't even see space, and when it's that basically jammed up in there, first question is always like, "Are you using Afrin?" And people are like, "No."
So to get off of it, you'd have to, your friends.
Yeah.
What-
Would
Friends,
you just
I'm
have to
sorry,
not,
your friends.
Right.
they would just have to try and grin and, if they wanted to get off it, grin and bear it for like several days until
Yeah.
the body
So basically, either you can power through it, or you can do you have to actually do a pretty decent steroid taper, like prednisone.
What are the long-term effects of that behavior for our friends?
I mean, it'll just stop working. Something called tachyphylaxis, where the more you use it, the less it works over time.
so the more you need.
Well, thank God. Well, I've tried to. I mean, my friends tried to get off it a few times, and when he does, he gets these super bad headaches, and I know it's the nerves right here in the head by the eyes that hurt so bad, and it gives him such a bad headache, or he almost goes blind sometimes. So it's quite the unfun experience.
Steroids, then.
Steroids help. They take away the headaches, or do you just pop Tylenol and just make sure
No,
you
it's
just go through it?
Usually, your primary would have to give you a good 2-3 week taper. Usually, I do a 1 to 2 week taper of prednisone while you're coming off that, and then do everything else, and then nasal steroids. More than what's over the counter.
It sounds like when you're coming off drugs. I mean, it does something
Pretty
to you.
much.
Yeah.
Off of anything that we do too much of, right? Our body's like, give it to me.
Yeah.
What is happening?
Right, and back to your thing about the person who's taking Benadryl to sleep. Sounds like a lot of work to me. It's
get
like,
clean,
to
clear.
get clean, to break the Afrin habit. I'll pass that on to my friend though. Kayla says, I have a shellfish allergy that was diagnosed when I was 10 years old. I'm 32 now. When I ate it, my throat became really itchy and I broke out in hives in about 30 minutes. I have slowly been eating shrimp, and I can now successfully eat shrimp without issue. But when I tried crab or lobster, I still broke out in hives. Benadryl will help control these, and I do not normally need to go to the doctor. Do I need to up the amount I eat to build up my immune system, or am I stuck with having this allergy? So diagnosed with shellfish allergy, she's eating shrimp, but then crab and lobster can't do it.
So those are all in the crustacean family, and it depends how much she had, and was it truly a shellfish allergy in the beginning? Because once you have it, you're kind of stuck with it. She's thinking about what we talk about, oral immunotherapy, right? Small amounts under the mouth, and they're working on patch versions of this, but it's risky. You can have anaphylaxis, which is why it's not done, because at any time, just because you haven't had it, if you have a true food allergy, in one time. It's kind of like Russian roulette. If you like playing Russian roulette, then go ahead. But it's one of these days that chamber's gonna hit.
I'd rather be told I can't eat bread than lobster or crab. Oh my God, that sucks.
Hello there, Holly. Good morning.
Hi, good morning.
Hey, go ahead.
Morning.
So I have a question pertaining to my husband. As long as I've known him, he's had chronic inflammation and pain. And he's had a back injury because of this also. And he's had some tests done with the doctors because when he eats any kind of gluten, it flares up all of his inflammation and he hurts for about 2 to 3 days, like if he eats pasta or drinks beer. And the doctors have determined that he doesn't have a gluten allergy, but anytime he eats this, and just in general, even when he doesn't, he's inflamed and has pain. And I'm thinking he has some kind of arthritis, but I don't know what the best way is to go about to find out what's wrong with him.
Yeah, if it's some kind of autoimmune thing you're concerned about, then a rheumatologist is usually the best. Your primary would most likely have to send some screening tests. And then, if there's like joint pain and, rashes or anything like that,
Sounds
then,
awful.
then yeah, a rheumatologist can even make the diagnosis with negative blood tests because there's clinical criteria that they can make.
Typical wife, always trying to figure out what's wrong with her husband.
Well, and typical dude, he's dealt with this basically forever and is just going to grin and bear it.
Yeah, the Sam Malone, right? The Sam Malone philosophy.
Right.
Yeah.
Ignore it. It'll go
It'll
away.
go away. Exactly.
And the husband right now is driving to work going, why'd you call? I'm not going to do anything.
Just ignore it some more.
All right, we're going to get you to the office. It's Dr. Patel from Granite Bay Allergy at granitebayallergy.com. Self-referrals are still allowed.
Yeah.
You do accept some insurance or all insurance?
All except, as long as the HMO or whatever, the primaries you should figure it out. But most PPOs, yes.
And there's so many things that you can treat, and you do treat that people don't even think about. Asthma, we talked about eczema. There's so many things in your realm that people write in and go, wait a minute, he can, anything we've left out that we should just quickly hit on that, hey, if you're suffering from this.
No, I mean, like anything you think of allergy, asthma, immune system, but not autoimmune, which is that's rheumatology.
Right. So go to granitebayallergy.com and you can get all that information. Thank you so much for being here. We love having you.
Thank you very much. Thanks for having me.